Do you have back pain? Have you been told to avoid lifting weights? In this video, we're going to show you why that might be exactly the wrong advice. Hi, it's Brody and Jack from Be Mobile Physio. We're experts in helping older adults overcome pain and injury, and it's fair to say we see our fair share of back pain.
Yeah, and this is not surprising, Brody, because back pain is the leading cause of disability worldwide. Now, you may already know that exercise has been proven to be one of the best things you can do to help manage long-term low back pain.
In fact, evidence-based guidelines recommend exercise as a first-line treatment for chronic low back pain. This means it should almost always be a primary part of a person's management strategy. These guidelines put exercise ahead of second-line treatments like massage, manipulation, medications, and surgeries. Extensive research has shown that lots of different types of exercise can be helpful for lower back pain, and that people should be encouraged to do what they enjoy most and that they can stick to. That being said, we have a particular bias towards strength training and in particular weightlifting as being one of the best things you can do to manage your back pain.
That's right, mate, and there's a big reason we have that strong bias towards weightlifting, and that's because it improves your strength, which therefore improves all of your daily activities. So think about things like picking up a heavy weight from the ground, whether that's shopping, maybe picking up your grandkid from the ground, or picking up a heavy bag of mulch in the garden. It'll give you more confidence in all your daily activities, whether it's getting up from the ground, squatting out of a chair, anything where you may have some aggravating low back pain.
So in a moment, we're going to show you how you can utilize weightlifting to build a stronger, more resilient back and take charge of your back health. But first, Jack, we're going to address one of the most common objections we hear to this statement, which is, that's all well and good, but I've got an MRI which has showed disc bulges in my spine.
The old disc bulge.
And therefore, I definitely shouldn't lift anything heavy. So let's address that first. If you've had an MRI that shows disc bulges and other things like that, of course, it can be a little bit scary. But what these MRI reports don't tell you is how common these findings are in people without back pain. And there's a lot of research showing this. In this graph, we can see some of the spine imaging findings of people that have no back pain. These are asymptomatic people. You can see that disc generation is prevalent in 80% of people in their 50s and increases up into the 90% by age 70. Disc bulges are similar, starting at 60% of people in their 50s and increasing across the decades. And even degeneration of the facet joints, which are the joints along the side of the spine, is really common, with 30% of 50-year-olds having this, and this increasing up to 70% in people over 70. Remember, none of these people have back pain. This tells us that these kinds of findings on a scan are not predictive of pain or disability. They are a normal part of aging. We can think of them more like wrinkles or grey hair than injuries to the spine. This should be reassuring because it shows that even if you've had a scan with these kind of findings, it can be okay to exercise and improve your back pain.
Thanks for sharing that graph, Brody. I think it's really helpful to know that we share this with clients all the time so we can reduce their fear around MRI findings. And some more evidence to show the poor link between image findings and back pain is that all of these findings go up as you get older, but pain doesn't necessarily go with that. So for example, back pain is highest in males in their 40s and back pain is highest in females in their 60s.
So if these bulges and other scan findings were the solely responsible for people's pain, we would see the highest rates of back pain in the oldest people, and that's simply not the case. So even if you do have pain and you have an MRI which shows these kinds of disc bulges, that doesn't mean your back is necessarily damaged nor fragile.
Yeah, so you can rest assured knowing that exercise is going to be beneficial for you. And we think using your symptoms and some common sense is a good way to guide yourself. It's all about starting at a manageable and tolerable level, and then over time you can increase the amount of exercise you do and the amount of weight you lift.
So, speaking of exercises, let's get into that now.
Okay, we're going to take you through one of the best exercises we give to clients to help them improve the confidence in their low back and help them lift things off the ground. It's called a deadlift. Now, Brody's going to show what that looks like as a full movement to start. You may have heard from time to time that this is definitely not an exercise you should do if you have back pain. We disagree, and we want to show you some modifications you can use to at least start the movement in a more tolerable way. So, Brody, what would you say is kind of the first step to start with.
Yeah, if that looks a little scary for you, don't worry, we're going to get you there. Jack, the first starting level is grab a chair, and you can hold a little broomstick or a walking stick for this one. You don't have to, but
Gives
it does
you a target.
help. Yeah. Jack's going to stand in front of that chair and just work on touching the stick down to the chair. Just like that. You might not even be able to get all the way to the chair comfortably, yeah? But that's your starting level. You can see how that mimics the deadlift movement I was doing, but in a much lighter and more controlled way to begin with, to start to build that confidence.
Yeah, and you're trying to keep the stick, or we're going to use a light weight in a moment, close to your legs, and we're bowing over. I think that's always a nice little tip, is to bow over.
Now, Jack, once you're feeling a bit confident with that,
Great.
you can start to add a little bit of weight. So just something light to begin with, a couple of dumbbells. You could use a milk bottle, a backpack with a couple of books in it. It doesn't really matter. Yeah. You're just adding a little bit of load there and asking these low back muscles to just do a little bit more.
Yeah, and we might even feel that in the backs of our legs, in our hamstrings.
Certainly.
And if you're holding enough weight, you might even start to feel that in your grip.
So that's level 2 of the exercise. Level 3 is we're going to get rid of the chair and start to do this in a more freestanding position, which will allow you to go a little bit further.
Okay.
And you can just, to begin with, go to a depth you're confident and comfortable with.
Yep.
Each time you do it, seeing if you can get a little bit further and being a little bit more confident with it.
Yeah, that's right. Now remember, the main tips here are to bend over in that bowing position and keep the weights close to your body. And for these exercises, we might be starting anywhere between 12 and 15 repetitions, so up the higher end of the scale for repetitions, just because we want to start with a fairly light weight and get our body used to the movement with more repetitions.
So you've been working on level 1, 2 and 3 for a few weeks. You're feeling a bit more stronger and more confident. Now we're going to get into something that looks much more like a traditional deadlift.
Bit of a block deadlift.
Yeah, I've got the kettlebell here and I've raised it up again to make it a little bit easier for myself as a starting level, and you can deadlift from there.
Yep.
And now I'm definitely getting stronger and I'm feeling more confident in what my back can handle.
Yeah, now Brody's picking something up from the ground, so it's more like a traditional deadlift. And as you said, you can just increase the weight over time to improve your confidence. If that wasn't tolerable, you can also reduce the weight. Yep. So Brody's just taken away a book, which means it's a little bit lower.
Yep.
So he's getting a little bit more flexion in his back and at his hips. So he's improving that confidence to get right down to the ground. And then, of course, get that book away, mate. We can do a full deadlift. Any key tips besides what I said about bowing, Brody?
Yeah, so the weight should start between your feet, ideally, if you're using something like this kettlebell. People might be worried about technique, about exactly what shape their spine or their back is in. It's not all that important. If you've gone through progressions and you've built up gradually with a weight you're confident with, then technique actually isn't as important as many people think. Yeah. And the research shows that you can just lift in a way that you feel safe and confident with and build up slowly. In that case, there's no perfect technique that you have to master.
Yeah, there's a great principle which is preparation trumps technique, so how you prepare them. So even if Brody had, more of a rounded torso like that, a rounded back, if that's the position he gets himself into when he's comfortable, that's actually all right to lift. Okay, so once again, letting your symptoms and a bit of common sense be your guide. So we recommend starting at the level which suits you. So maybe you can actually start with a full deadlift, but just select a weight which is tolerable and manageable. But Brody, as we said before, it's all about slowly building up over time so that when you get into the garden or pick up the grandkids, you're confident to do that?
Yeah, absolutely, that's it. So you can practice any of those levels, build up over time. For all of them, 3 sets of 12 to 15 repetitions each time with a bit of rest between each set is a good starting point.
And you can chuck that into your regular strength training routine as another exercise, and I think it's a really good addition.
So there you go. That's how you can utilize a weightlifting exercise to build strength and overcome your back pain.
All right, let's go through the main takeaways from the video. Firstly, exercise is a great way to help manage your chronic low back pain.
Almost any type of exercise is going to be helpful, but we think lifting weights is one of the best bang for buck options. It doesn't necessarily help back pain more than other types of exercise, but it has so many other benefits that we think it's well worth it.
And when starting your resistance or weightlifting training, make sure you start at a manageable level and slowly progress over time. And you might be surprised by what you're capable of. If you'd like to see more ways that you can improve your low back pain and get fitter and stronger, well then subscribe to our channel.